If you're having lower back pain and you do not know what your multifidus is, that's a big problem. Hey everyone, welcome to the Front Row with Ed Deboo, physical therapist, integrated physical therapy, Bellingham, Washington. I'm going to talk about the multifidus muscle for all of you people out there that have lower back pain. Let's first meet the muscle and see where it lives.
As you can see in this picture, the multifidus is highlighted in orange on the right-hand side. The multifidus lives deep in the spine and works to stabilize at each vertebral level. In people with chronic lower back pain, imaging studies have shown that the multifidus is actually replaced by fat. And fat is not a good stabilizer and can lead to recurrence of lower back pain. The solution is to strengthen the multifidus.
As you just saw, the multifidus muscle, it lies deep along the sacrum here and then in between each vertebrae, providing stability for the segments. Studies have shown, like I said, if you have a weak multifidus muscle, you are more likely to have lower back pain. So what do we have to do? Add a simple multifidus strengthening exercise to our program. I'm going to show you a couple ways to do it. We'll start easy and work our way up to a little bit harder. Idea is to want to do it 3 times a week if you can, anywhere from 3 sets of 8 to 10 repetitions. The thing to remember about this exercise is that you want to make sure that you are in as close as you can to lumbar spine neutral. So neutral, what it signifies is I'm not all the way anteriorly, I'm not all the way posterior. Now some people have a natural posterior tilt. So in that situation, they're going to want to be a little bit more anterior. Some people have a huge anterior tilt already. You want to contract that lower ab and come back in. Either way, the cue that I give my clients is try to bring that belly button back towards your spine. That contracts the transverse abdominis, which helps to stabilize the lumbar spine. Let's talk about the exercises.
The easiest way to do multifidus strengthening is to lay on your stomach, make sure your head is supported, have a pillow underneath your hips, keep the knee locked, and slowly lift up approximately 6 to 8 inches. Hold it for a couple second count and return back to neutral. When you're counting, back and forth is 1. What you want to try to shoot for is 3 sets of 8 to 10. Once that gets easy, you can progress to a little bit harder multifidus strengthening, which is on hands and knees, and then you're kicking out just a leg. Now you'll notice my hands are right underneath my shoulders, my scapula in the back pocket, and my neck is neutral. Once that starts to get a little bit easier, you can put a dowel or a stick or a broom handle back there to keep that pelvis as level as you can. Once again, start with just the legs. Hold it for a couple second count and return to neutral. The sticks are rocking a little bit, but it's not falling, and that's the goal. Once that starts to get a little bit easier, the last step would be to add the opposite arm. You can hold it for a little longer if you want to, anywhere from 2 to 5 seconds, and then return to neutral. Remember, back and forth is considered 1. We're looking for 3 sets of 8 to 10. Repeat this 3 times per week. Simple, but it's a great way to strengthen the multifidus.
So a thing to remember, the multifidus muscle is very critical for lower back pain. Simple exercises, come in where you can. Ideally, like I said, I like the 4-point stance, alternating arm and leg. If that's too much for you, try just the legs. If that's still too much, get on your tummy, put a pillow underneath your hips, and just lift up your leg. But you really have no excuse for not doing at least 1 level of a multifidus strengthening exercises. If you have any questions, let me know down below. If you haven't subscribed, make sure you do, and good luck.